Hello, I am pleased to bring to you histology of the liver. We are going to have a very exciting lecture, but it's a very important organ of the body. Is the largest, and as we say in our local parlance, menyonko brebo. The brebo is actually the liver for the akan. Okay, when the akan wants to say liver is brebo. So it's a just like saying my friend liver, right? So we want to look at what my friend liver actually consists of histologically. So this is a picture of the liver. Okay, it has several lobes, and I'm sure you might have come across the left lobe, right lobe, caudate lobe, quadrate lobe. Yeah. So the human liver is supplied by the hepatic artery and then the portal vein, and it is drained by the hepatic vein, which is connected to the inferior vena cava. That is the gallbladder. We looked at the embryology of the liver and the gallbladder, so we know it develops from the ventral, diverticulum of the foregut. So we know that already. So we know that that's the cystic duct. Yeah, cystic duct, and then you have the hepatic duct, and then they join to form the common bile duct. So this is showing you another diagram of the liver, which has been broken into segments. So you have the portal vein, the hepatic vein, then that is the bile duct, that is the cystic duct. So you have the right and left hepatic duct joining the cystic duct to form the bile duct. And we know that the bile duct opens into the duodenum at the ampulla of Vata. So these are hepatic veins that will drain the liver into the inferior vena cava. And as we will see, they drain the central veins, which are also connected to sinusoids in the liver. And then the central veins will accumulate and then join to form the hepatic veins. The portal vein and the hepatic arteries supply the liver with blood and enter at the hilum. Blood is drained by central veins which merge to form the hepatic veins. There are some concepts of liver lobos. We usually call it the liver lobo concepts. We have three of them. You have the portal lobo concept, you have the hepatic lobo concept, and you have the hepatic echinus, also known as hepatic echinus of Rappaport, which is the name of the scientist. You can say Rappaport if you don't want the T to sound, okay, like a French. So portal lobo, hepatic lobo, and then hepatic echinus of Rappaport. When you look at this, you realize that the portal lobo is joined at the vertices of this triangle by the central veins, okay, of this hexagonal structure of the hepatocytes. Then here, the hepatic lobo is the entire hexagonal structure of a complete hepatocyte with portal triads at the corners of the six points of the hexagon. Okay. And for the hepatic echinus of Rappaport, you have portal triads in the middle, and then they drain towards the central vein instead. So you have these zones, three zones, zone 1, zone 2, and then zone 3. The green region is an indication that there's a lot of blood. And obviously, if the blood is also coming with toxins, that is the area that will be affected most. Then followed by zone 2 and then zone 3. So these are the types of concept of liver lobos: classical hepatic lobo, the portal lobo, and the hepatic asinus of Rappaport. So that is the hepatic lobo. Pardon the spelling for the lobo. Then you have the portal lobo in triangle. This is hexagonal, and then this is diamond shaped. So that is Mr. Rappaport. So we want to take the classic lobo first. It's sometimes called the classical lobo concept. Always remember that it is hexagonal with portal triads at the corners and then the central vein in the middle. So a classic liver lobo is supplied with blood from the corners of the hexagon by portal veins and hepatic arteries. Okay, so portal veins and hepatic arteries, and branches of those hepatic arteries and portal veins, and then the bile duct form the portal triad. So that is portal triad. That's the central vein. And for the portal lobo concept, uh, you have the triangular shape joining central veins, okay, and then the portal triad is in the middle. Then the hepatic asinus of Rappaport is the diamond shape with the 3 zones: zone 1, zone 2, zone 3. So let's expand it and then enjoy it. So that is central vein, okay. So once you have the drainage going towards the central vein from this portion where you have the portal triad, you are talking of the hepatic sinus of Rappaport. So zone 1, zone 2, zone 3. So zone 3 is the one closest to the central vein and receive the least amount of oxygen and food, and also will be the one that will be most preserved when there's toxin, okay, and vice versa. So in the liver sinusoids are coffer cells. So these are the sinusoids. The sinusoids are more or less venules, okay, within the liver, and they are in between two hepatocytes. So wherever you have two hepatocytes in between, then you have a sinusoid. So you have a sinusoid there, a sinusoid there, sinusoid there. These are my micrographs that I prepared during my master's level. So these are mice liver that were infected with Plasmodium bergeri, which is a specialized type of Plasmodium parasite that affects only rodents. So I infected the mice with those Plasmodium bergeri and I examined the liver. So you can see that this one was one of the mice that were infected but did not have any intervention. So they were very prone to the malaria attack. These ones were also infected but were given some cocoa to ameliorate the effects of the parasite or the malaria. So within these ones, you can see that they are very large sinusoids. So we say that the sinusoids are dilated. That is an indication of what? An insult to the liver. Then you see these are macrophages called coffer cells, which was named after Carl Wilhelm von Coffer. So that's a coffer cell. That's a coffer cell. They are there to mop up, debris and microorganisms or infections. So again, you can look at this. This was the central veins of some of the infected mice of my work. And you can see a lot of debris within it. You have copper cells there, accumulated there. Then you have this very clean central vein with a control mouse which was not infected at all. Okay, yeah. And this is also a picture from online, also indicative of corpus cells within sinusoid. These are hepatocytes, and these are the nuclei of the hepatocytes. Okay. And the corpus cells also destroy old erythrocytes and break down hemoglobin to bilirubin. So in a very low power microscope, you are going to see something like that. Okay. The white areas are central veins. Then when you zoom in a little, you are going to see this kind of, micrograph, and the central veins are there. So this one just assumes a hexagonal shape, as we said, for the classical logo. So you expect the T to stand for portal triad. The C will be the bar canaliculi, which will contain bar. Then another portal triad will be there, have another canaliculi there. So this is how the liver will look like under the microscope. Hepatic tissue can be subdivided into functional units, which are called classic liver lobules. In humans, on the right image, the hexagonal-shaped classic liver lobules are not separated by connective tissue septa. A classic liver lobule defines the volume of liver tissue from which blood is drained into a single central vein. So this is more of a pig liver, which will have a lot of connective tissue outlying the hexagonal structure, but in humans, you don't see it that much. Okay. However, this is still a high power, and this is a low power relatively. All right. So there you go again. You have the portal triad there, hepatic artery, you have the bile duct. Okay. And then you are seeing some lymphatic vessels, and that is the portal vein. And these are hepatocytes. And the basophilic areas are all the nuclei of the hepatocyte. And the eosinophilic areas are the hepatocyte cords. Okay, that is the parenchyma, hepatocyte parenchyma. So in a very simple drawing, this is what you see. So the central vein will be there. So blood will be draining towards the central vein from the portal triad, okay, especially the branch of the portal vein. Then also the hepatic artery. Then the bile flows in the opposite direction rather, okay? It flows in the opposite direction instead. That's against the direction of the blood flow. So these are bile canaliculi. You see what they are very soon. Those are the sinusoids that will collect the blood towards the central vein. These are all sinusoids. So the spaces between these walls are called the liver sinusoids. Blood flows from the periphery through the sinusoid between the cords to the central vein. So when we zoom into just one hepatocyte, that's the nucleus. These are endoplasmic reticulum. This is the rough type. You have mitochondria there. Then these are microvilli of the hepatocyte. So the microvilli of the hepatocytes project into the sinusoid. So there's one sinusoid here, there's another sinusoid there, and these are microvilli or extensions from the hepatocytes. Then you can see that just before the sinusoids are these layers. Okay, these layers, you see reticular fibers, and these are actually endothelial cells, fenestrated endothelial cells. So that is how the sinusoid look like. The sinusoid, as I said, is just like a venule or any blood vessel, which is fenestrated, okay, to allow the substances to get into the hepatocyte. Now, before they get into the hepatocyte, they have to cross this small space, the space between the endothelial layer and then the microvilli. And this is known as the space of Dis, also named after this gentleman, Joseph Hugo Vincent Dis. Okay, so that is how it comes about. Now, when there's infection, the space of this is also going to be larger, and then the microvilli are going to be shorter. Okay, I'll show you some of the pictures from my work of the mice that showed some of these features. So again, that is the space of this with the extensions of the microvilli. This is an electron micrograph, transmission electron microscope. Then you have the endothelial cells. That's a sinusoid within which you have blood cells. When you stain the liver with silver, you have the collagen coming out as black threads. Okay, all these are the liver reticulin collagen type 3. This an electron micrograph. Okay, this is more like a scanning electron micrograph, which is scanning the inside of an endothelial cell or a sinusoid, okay, with the endothelial cells showing. So these are the fenestrae you find within the endothelial cells, which will allow for passage of substances. Then during insult to the liver, you have what we call fat storing cells or Aidoo cells, which is also named after Tashio Aidoo. They contain large droplets, lipid droplets, and appear to participate in vitamin A metabolism and are induced to deposit extracellular matrix molecule during liver cirrhosis. I saw something like this, Aidoo cells, in one of the mice that did not receive any intervention. This is also transmission electron microscope from my PhD work, where I examined the liver of rats. So again, these are this is a sinusoid, and that is the endothelial cells with fenestrae. And then you can see the perisinusoidal space, or the space of this, with a lot of microvilli from the hepatocytes. Okay, so I counted the microvilli extensions and estimated its volume compared to the other groups of mice. All right, so this is also a coffer cell within the sinusoids. And you can see these numbers, I was counting points that hit the coffer cells to estimate its volume as well. These are rough endoplasmic reticulum. And then also this is a periodic acid shift stain which reveals collagen within the hepatocytes. Okay. So in the hepatic sinus of Rappaport, you have these zones, zone 1, zone 2, zone 3. So zone 1, we know this will be the portal triad canal, or the portal canal. So you have portal triad there, you have another portal triad there. We know that zone 1 receive a lot of the oxygen and then food in the blood, followed by zone 2. Zone 3 will not have much. So usually they are the ones that get destroyed or damaged due to lack of blood supply. But if there is a toxin, then you end up rather having zone 1 getting a lot of the share. So cells in zone 3 are least supplied with nutrients and oxygen and are therefore prone to fatty metamorphosis, fatty change, and ultimately necrosis. So we call that steatosis, non-alcoholic fatty liver disease. Repeated liver damage can cause liver cirrhosis, and it is usually depicted by a lot of fibrous, collagenous fibrous nature. Okay, so you have that, all those you find there are collagenous tissues. So liver cirrhosis usually involves the pathological accumulation of connective tissue, fibrous scar tissue that destroys the organization of the liver and ultimately results in the death of the liver. This H&E stain micrograph shows abundant scar tissue that has replaced dead liver cells. Okay, so instead of having a lot of hepatocytes, they are rather having a lot of collagen. This trichrome stain shows the accumulation of collagen in cirrhotic liver tissues. Then the bar canaliculi are lined by the plasma membranes of two adjacent hepatocytes, okay, and are sealed by tight junctions and end in simple cuboidal epithelium, which will contain the simple cuboidal epithelium cells. So that is the bile duct with the simple cuboidal nature of cells. That is the canals of herring, also named after that gentleman. Then we look at the gallbladder. So the gallbladder is very characteristic. This is how it looks like because it's always attached to the liver. Sometimes you see micrographs of gallbladder and then you also see hepatocytes attached. It stores bile. So if you take just one finger-like projection, as we saw many in the previous slide, this is how it will look like. It actually looks like an intestine with a so this a mucosa core. The mucosa, the submucosa is beneath. This is a mucosa core. So that would be the epithelium. So that's a mucosa core, not a submucosa core. Mucosa core. And the emphasis is here. So mucosa thrown into folds. That is liver. And then that's the muscle. So we have looked at the liver, and then we said that it is supplied by the portal vein and then the hepatic vein. And these two plus the bile duct, branches of them form the portal triad. And we have also said that the liver has a lobo concept. One of them is the classical lobo, which is hexagonal, with the central vein in the middle and blood moves from the portal triad towards the central vein. Then we also looked at the portal lobe, which is triangular in shape, and the three vertices of the triangle connect the central veins of hepatocyte. Then also the hepatic acinar of Rappaport are the ones that have two portal triads that send blood towards the central vein. And in so doing, it has three zones: zone 1, zone 2, zone 3. Zone 1 gets a lot of fresh oxygen and food, and then it trickles down to the rest of the zones that receive smaller quantities. Then we have also looked at the sinusoids and then the fenestrations of it, the space of this, or the parasinusoidal space, and then the hepatocyte microvilli that project into the space of this. We have also looked at the fact that the liver can undergo cirrhosis, and then the hepatocyte themselves can be replaced by collagen fibers. Okay. We have also looked at the gallbladder and the fact that its mucosa throws the epithelium into folds. All right. So basically, this is what I have for you today. I hope this helps. Thank you very much.